Hi, I'm Dr. Farah Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between. Hello, we are back. I'm so excited for it today. We have again one of our San Francisco Bay Area legend dermatologists, Dr. Vail Reese, who we all know so well. Needs no introduction, but he is at Union Square Dermatology and has taught us so many things over the last couple of years on the podcast about different formats of how dermatology is seen in movies and art. And we are back for another installation. So thank you so much, Vail, for joining us.
My delight. And this is a topic that I've been very interested in for a long time, but I had never formally sat down and prepared for. So thank you for inspiring me to move forward with this.
And we keep bugging you for more. Right when you think you're done with one topic, we're like, well, can you also do this? And we love learning from you.
And I'd love to be participate in it, Fair. So I really appreciate being involved. So it turns out this topic, dermatology and art, this actually predates for me dermatology and movies. So here I was, a resident, dermatology resident at Brown, and I would go to the academy meetings, and John Wolfe, who for years ran the program at Baylor, would give a lecture on dermatology and art, and he will go over some of these examples that we're going to go over today. And I'm taking this all in, really enjoying it, and thinking, wow, it's these paintings are all very interesting, but what about movies? And that's really was one of my major inspirations for looking at dermatology and movies, which is kind of taken on a life of its own. So for me to present this today really goes back to my roots as far as interest in this type of area of exploration.
That's the origin story of Skinema.
It's true. It's true. It's funny. So it turns out that since art is visual and dermatology is visual, we can actually find examples of skin conditions in very ancient paintings, but much more in paintings from the Renaissance. So some of the earliest examples, it turns out the Romans and the Egyptians really didn't. You don't see any cutaneous abnormalities. There may be discussion at some point about hair loss, which was kind of actually a fashionable thing in the Egyptian times. But actually, for our purposes, the first times you actually see something that looks like a skin lesion is actually paintings and woodcuts from the medieval times. And the reason why is that a lot of their subject matter were images from characters and stories from the Bible. And there are two particular stories from the Bible that lend themselves to this. First of all, there was a Saint Job, Job. And Job's story was that he believed in God, but I think he took God a little bit for granted. And so God, for whatever reason, visited upon Job a terrible, terrible dermatitis. So we don't know to this date what Job had, but it was bad. It was extensive all over his body. He had abnormal skin. It was incredibly itchy and painful. And he put up with this for years until eventually, basically, God was testing his faith. And Job at no point lost his faith in God, apparently to this biblical reference. And so at some point, God freed him of his dermatitis. So super interesting. We'll never know what Job had. Was it psoriasis? Was it atopic dermatitis? Was it leprosy or Hansen's disease? We don't know. But again, this will show up in medieval and some Renaissance paintings. And then what we'll see actually more commonly, which I alluded to already, is leprosy, or what we now call Hansen's disease. So one of the miracles that Jesus purportedly performed was to cure some lepers of their leprosy. And of course, this was pre-antibiotic era, right? It's 2,000 years ago. But this will show up in different Renaissance paintings as individuals who have these blotchy dermatitis. Um, and interestingly, though, we understand now that what a lot of people called leprosy or Hansen's disease centuries ago almost certainly was not that. It could very well have been psoriasis, atopic dermatitis. It could have been just tinea, fungus. I mean, imagine there were no treatments for fungus. So you can imagine people had probably total body exanthem, which actually represented tinea, scabies, any number of things. So, but this will show up in these Renaissance paintings with different examples where you see these things. It becomes clear when you look, especially in the Renaissance era, that it's not it doesn't really look to us like what we would expect Hansen's disease. So you think maybe it was psoriasis or something like that.
That's so interesting. Like, as you're telling me this story, and like it makes me realize we see all these patients every day in clinic, and there's all these psychosocial things that come with dermatitis, psoriasis, everything, right? And we're like, well, what's the root cause of all these things? And it's these cultural things that have just seeped through thousands of years in art and storytelling and religious textbooks. It's just fascinating for us to take a moment and revisit it. So thank you so much for like, reviewing all this with us because it's not something you're thinking about in a day with 25 to 30 patients. But I mean, there you can't ignore culture when we're in the field where our faces and their skin is like so interfaced.
Exactly right, and, centuries ago, it did make sense. There would be some social stigma. If you saw someone and they might have a contagious condition, although you and I both know that it's actually pretty hard to pick up leprosy or Hansen's disease. It's usually family members or long-term exposures. Although it is still out there, of course, especially in places in India, and in, Asia, not as much in, kind of the Western scene. But psoriasis, atopic dermatitis, these are not contagious conditions. So, this whole social stigma, we really like to be past that, and I think education plays a nice role. Now, a big change happens, with respect to Western art in the Renaissance, because you actually have these artists, Leonardo da Vinci and Rembrandt, who now have obtained a level of expertise that they can create essentially photorealistic painting. This was not something they could handle in the Middle Ages, but now we're in the Renaissance. So when you think of the Mona Lisa and some of these other paintings, there's an example, Ghirlandaio Domenico, who is an Italian Renaissance painter, created an image that showed an old man with his grandson. And the old man has this bulbous nose, which we now recognize most likely as end-stage rosacea or rhinophyma. But it turns out the boy in the picture has a little fold under his eyelid, which is actually a marker for atopic dermatitis called the Denny Morgan's line. So you actually now not only have Renaissance painters who are capable of recreating this photorealistic skin conditions, but also want to show a realistic painting. They actually don't want to kind of Photoshop or whitewash. They actually want to show what these individuals actually look like, which was a kind of sea change in attitudes about painting. So, but there's many examples. There's actually a lot of examples of rosacea. You can imagine it was pretty common. No sunscreen, people drinking alcohol, especially in Northern Europe. And so they start to show up in some of these Flemish paintings, not just as some of them will be individuals who are out there drinking alcohol. So they knew even then that there was a connection between alcohol and rosacea. But there's actually paintings where you'll actually see one of the saints, one of the biblical saints, and they've conveyed him as having rosacea, which is a super interesting choice. They didn't have to do that, but they were in a mindset of let's make some realistic examples. And then there's an amazing painting from the 1500s by an Italian painter, Lotto. It's called A Young Man with a Lamp. And it shows a young man, very good looking young man. But you look closely, very unbelievably, you can see a cyst in the middle of his forehead. You can see small dots. These are basically blackheads. They're open comedones recreated meticulously by this Renaissance painter. He didn't have to do that. It's just, but for amazing for us to see that even in the 1500s, teens were dealing with these forms of acne. So it's nothing new.
Acne's always been it's been plaguing us for forever when we have historical fiction, and it actually, what kind of makes me think of, like, during the pandemic and the Zoom era when our cosmetics kind of just shifted based on people just seeing themselves on the screen that often, even though we've had screens forever, but it just kinda created I'm like, I wonder what cultural shift these realism paintings did. They're like, "Oh," I mean, the mirrors have always been there, but you'd wonder, the guy looks at his picture and you're like, "Whoa, those were on my head? I didn't I didn't know."
Exactly right. I mean, at least now with Zoom, we got the filter, right?
True, but then they put in the filter, so that problem was taken away quickly.
Now, in dermatology and movies, as we've discussed before, there's a major trope, which is that if you see a facial scar, it's going to be a villainous character. And not just facial scars. And we're talking Darth Vader, we're talking Starface, we're talking Freddy Krueger. And other things, hair loss can be used to show villains, and tattoos can be used to show villains. So we look back through these Renaissance paintings, that doesn't seem to be a thing. We don't really see scars in the Renaissance to portray an evil character. Uh, while that's been seen in paintings, it's actually only been in the 20th century. I have a couple examples. A German painter, Otto Dix, he actually depicted an actual dermatologist from the 1920s who he gave a big facial scar and made look very scary. And then I have an example from a palace in Mexico City where there's a mural showing this executioner and he's got a facial scar. That painting is actually from the 1970s. So both of these were paintings that were done actually since the creation of film. So my thought with those painters is that they're actually pinging off of the trope from movies. That's in influencing them. But in the Renaissance, you don't see this. What you see, interestingly, is characters who have some kind of a skin rash and patchy hair loss. You'll see patches of hair loss in the beard. You'll see patches of hair loss in the scalp. And these are biblical paintings showing individuals who are either tormenting Jesus, they're torturing Jesus, or they're visiting terrible things on saints. A lot of the saints died in horrific ways. Saint Sebastian was shot with all these arrows and he died that way. But one of these paintings actually shows one of the archers with his patchy alopecia hair loss in the beard. He's got his teeth are off. Turns out it's syphilis. It's the appearance of syphilis. So syphilis was a huge, huge thing, terrible, spark-heat infection, usually transmitted sexually, although you can get it, can be born with it, congenital syphilis too. And it basically plagued Western society as well for a few centuries there until the advent of penicillin. And I don't know if you're aware, but doctors who specialized in treating skin were called dermatologists. They were also called syphilologists, basically, because if you treated skin, you had to know how to try and manage syphilis, which was, they didn't have any great treatments, basically. They gave mercury. It was terrible. Anyhow, so you'll see these characters from medieval and Renaissance paintings with this patchy hair loss. And it's very interesting. They must have realized at the time that syphilis was also transmitted sexually. And if you're depicting a biblical scenario where you might have some judgments from a religious point of view about people who are having sex outside of marriage or whatever, these painters actually decided, let's make these archers who are shooting at Saint Sebastian appear to have syphilis. It's
That's
fascinating.
that's very fascinating, and you're right. That is our dermatology origin story. The field, and correct me if I'm wrong, comes from venereology, right, and like kind of STIs, and that was beginnings of kind of academic dermatology, and then of course we morphed into understanding all the things we know now. So I mean, I wonder, I'm like, well, what has been our role in culture? We've always kind of been
Right.
the defenders of the underdog, right? The people that are getting persecuted and harassed because of either some choice they made, like syphilis, some life choice that led them to that pathway, or congenital syphilis, not their choice, or just an inflammatory condition, which was just genetic and kind of happened to them. But then society puts all these things on top of it and all this guilt and all this burden on this person. So the derms have always been there
We've always been there. That's right.
for that person.
Yeah.
I just wanted to make that comment.
That's a very good point. And then it turns out by the time you're at the Renaissance era, and more recently, they actually did end up painting individuals who knew they had syphilis. So there's pictures by Rembrandt who showed an individual who has congenital syphilis. You could tell he's got this depressed or saddle nose. There's a painting from the 1800s, anonymous painter, we don't know who painted this, showing this guy who's got this terribly eroded nose from his congenital syphilis and these abnormal teeth. They would get these notched and abnormally shaped teeth called Hutchinson's teeth. Again, any dermatologist or syphilologist would recognize these signs to know this was syphilis. But these painters decided, let's show what this individual looks like. And somehow these individuals were on board with this because they're paying for these paintings, and yet they're fine with them being depicted in this way, as opposed to, again, what we now call photoshopping, which is conveying these same individuals, but beautifying them and not showing what they really looked like. Now, I'll finish off with something I didn't realize until I really researched this topic recently, but it turns out one of the most famous paintings of all time actually has a skin condition, and that's the Mona Lisa.
Oh,
There's one so the Mona Lisa doesn't have much eyebrows, and I think that was more of
right.
a, Florentine, um,
That
uh,
was a cosmetic choice at the time.
cosmetic choice in Italy in the Renaissance. But if you look closely at the Mona Lisa, and we can't really because it's in the Louvre and it's under glass and it's a very small painting too. If any of you have been to the Louvre in Paris, it's very small. But if you get a magnified image, right about here, there is a small kind of white orange dot, small white orange papule. This is not a defect in the painting. This is an actual painting. Leonardo da Vinci actually put this little dot there. My gosh, it is either going to be a small milium, so a little cyst, which is very common on the eyelid, or xanthelasma, so a little lipid deposit a little cholesterol deposit sitting on the face of the Mona Lisa. So that just shows you, I think,
Yeah.
how much skin can be depicted and does interact with art. If the Mona Lisa's got a skin condition, um,
Yes.
what can we say? It's worth looking into. And I think it's amazing. And the fact that Leonardo da Vinci not only saw this lesion, took the effort to do this lesion, but recreated so exactly that we can make that diagnosis centuries later is just, I think it's so fascinating.
That's amazing. You said it's a choice. This is a choice that this artist made to depict this like small feature. And then it opened. The interesting thing is, I'm sure I mean, the Mona Lisa has been talked about in so many ways and so many things and culture and all of that. But you put that little extra detail and you could almost open up an entire world of, well, let's dig more into this and who was this person and what was their life and why did they have high cholesterol? Or it opens up a whole one little skin finding opens up this entire world. You could teach another semester at a college. What did this mean? So and I think that's the amazing thing about I'll come back to how amazing dermatologists are. We're a little biased here, but that can happen. Sometimes we'll have a skin finding, like maybe someone's just coming in for something very random. I would say, and this is rare, I don't find genodermatosis that often for some reason in the past 2 months. I think one patient I found with HHT, she was just coming in to have a futile telangiectasia on her lips lasered. And the other one was coming in to have a cafe au lait spot. And these are in their adulthood, cafe au lait spot on their chest, kind of like coast of Maine looking. So we did a bit of background and maybe some positivity there for some genes there. But I think that's not a common thing, I should say. That most times we're not seeing, dermatosis walk through our door, but then you see this one thing and it opens up this whole world onto what's going on the inside of this person, which is, I think, something that's not realized in what we do.
Correct. And again, and it comes up periodically that we'll recognize some type of skin condition, which is actually a reflection of some other deeper medical issue. Like it was several years ago, but a guy came in also with xanthomas kind of on his arms and kind of eruptive. They'd come up, and that's not normal. So we checked his blood work, and sure enough, his liver was totally whacked, and he was basically having a kind of an alcoholic related hepatitis manifested by these skin conditions. So, just so everyone knows out there, we're trained as dermatologists to recognize these things and then refer appropriately to internal medicine or what have you. But to consider the fact that even the Mona Lisa might have benefited from a little medical intervention is
That's right.
super interesting.
She should have had a dermatology consult. We could have one checked her lipids, but also have treated her lesion
Exactly.
as well.
And then the final thing that we definitely seen as a through line from painting to film is the beauty mark or the beauty spot. And there will be examples from Renaissance painting where you see the dark mole, and then you see the one where now this woman has several. In fact, it was actually fashionable to create little dark spots to draw attention to the eyes and the lips, kind of features that are considered beautiful because of their presence in youth. And that's a direct lead up to Marilyn Monroe and all the many actresses who basically basically accentuate the beauty mark, kind of drawing attention to these features for the reasons that I think we've discussed before.
That's so interesting. I love that lecture you've given about, was it last year? It was at the Half Moon Bay where you had the map of where your moles are and what it means, and we need to hear more about that.
Yeah, we could do a whole talk on beauty marks
There needs to be
because
a whole talk on this, and then we'll have to have it write another article.
they tend to aggregate in the areas that are gonna accentuate these certain features, and I'll have patients who'll come and say, "Oh, doctor, can't you remove this mole?" Well, I certainly could, but why would I? People basically make a little extra effort to darken a little spot here. Or some people get tattoos in a beauty mark location or a piercing in a beauty mark location. So I try and steer those people away. Whereas a dark spot elsewhere may not have that same social benefit. And so we have that discussion with patients.
One thing that comes to mind, we have so many tools in clinic that sometimes we'll use a handout or some visual to explain a concept to a patient. I wonder if you could create a one-page visual of the moles and we just all have it in our office because we all kind of show this or talk about this to our patients to some extent. But if we can just like put up the map to their face and say, no, that's a cute mole. You're going to keep that. There's efficacy there's a point to having that. Maybe we can on top of everything you're doing, if you could also create us a handout, that would be wonderful to have.
And it's interesting, I've actually had this discussion with certain patients. There are certain Asian cultures who they say, "Oh, that's very nice, doctor," but for whatever reason, cultural reason, they actually want that mole gone. So I think it is kind of a Western cultural phenomenon. But again, people don't realize. I mean, Cindy Crawford mole here. I'm not going to remove a small dark mole on someone's right adjusted to their lip. It's a great way to draw attention in their lips. So I would always kind of move them in a different direction with that.
That's right. It's so great, and there's so many things that we learn from you. And then we also you have an article out too that we will put the link to below on the art of skin that just came out as well. And then we're gonna have to hear so much more about this, over time. Is you're opening up our minds to things we're seeing every day, but we're not necessarily thinking about the history of it and all the things that have come before.
Absolutely, and especially with dermatology and movies, I'll bring this up to patients, and they'll think about it, and then I'll hear later, they'll say, ever since you mentioned that to me, doctor, I see all these skin conditions in movies now, the birthmarks and the evil characters and occasionally the sympathetic characters. So it's a perspective that I think once you've heard about it, you can't unhear it. It's a
Can't unhear it. You can't unhear it, you can't unsee it. We're all gonna go look up the Mona Lisa now, look for that xanthelasma. And of course, we're talking about history, but this is the Future of Derm podcast. We have to ask you about the future. What are you excited if there's anything within the art world and dermatology that you're excited about for the future, or anything else about the
That's
future
a
of
good
derm?
point. I mean, it's with modern art, you get kind of a movement away from a lot of the realistic depictions. Although interestingly, Van Gogh or Van Gogh, depending how you pronounce it, he can't claim his stuff looks realistic. But he actually did a painting of a young woman who appears to be she got an olive skin tone. She actually has melasma in this painting, which is the hormonally related and sun-related pigmentation that young and middle-aged women will get. So I think it'll be interesting to see as we move forward, again, with these less realistic depictions, are they going to rely on skin conditions as much? Maybe, maybe not. It's a good question.
Yeah, and then there's so much more kind of digital art coming out too that is, kind of our common thing now, and there's social media and all these different ways for people to kind of express themselves. So it's interesting to kind of just see the trends and where dermatology goes. And
Will AI say that scars are bad? Or will AI oh, here's another interesting thing. So, we're actually looking right now at a different topic, which is, basically anime. Anime, the Japanese, usually animated and cartoon, genre, which now pops up in video games and film and on television. Well, we looked at, anime looking at whether scars were on these heroic characters or not. Turns out the heroes in anime have scars, which
oh
is
wow,
very, very interesting, and it turns out almost certainly related. There's a whole, basically mindset for the last few decades in Japan. I forget the exact name of it, but it's one where if you have a piece of porcelain and it breaks and you glue it back together, that the scars actually are not, looked at in a derogatory way, that they're looked at as a level of experience. and maturity and individuality. So my guess is that cultural mindset that's even in humans, that a facial scar is not frowned upon or stigmatized, but rather it's a reflection of experience. I think that's actually showing up in anime, which is
I love that, and I hope some of that crosses over to our Western cinema as well. Well, thank you so much. As always, very excited for the paper on anime. That's a world I haven't even. I mean, I'm forced into it sometimes because I have 8-year-old boys, but but it's not something that I necessarily took a deep dive in. And it might not be something that others have. So I'm so excited for that because you're going to even take us to another whole world that we haven't possibly thought about. We went lots of. Thank you so much for everything you do and taking the time. And this was fantastic. Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.